conducted by the unit of the training and capacity building in the One Health Center, National University Sudan, which is entitled Navigating the Academic Publishing Landscape. The presenter will be Dr. Alkhair Adam and Dr. Awadallah me. The facilitator will be Professor Abdullah Osman. This workshop will be a 4-day intensive workshop and online interactive format. About the workshop, the target audience is early career researcher, postgraduate students, and junior faculty in Sudan, and even from outside Sudan. We have here colleagues from Gambia and other countries. You are most welcome. The duration of the workshop will be 4 days intensive, focused on training sessions. The workshop will be online interactive lecture, live demonstration, and practical and question and answer sessions. The rationale and background of this workshop: many young researchers possess a strong methodological skill and generate valuable data, but yet they are struggling in navigating the complex and rapidly evolving landscape of academic publishing. And they have a knowledge gap, and this knowledge gap leads to high rejection rate from journals, vulnerability to predatory publishers, and the third things, which is low visibility of research output. So our purpose to demystify the entire publication life cycle and empowering a young Sudanese researcher to confidentiality, write, submit, and promote their scientific contribution on a global stage. Our aim and objective in this workshop to equip an early career researcher with practical skills and strategic knowledge to successfully publish in reputable peer-reviewed international journals and build their strong digital academic footprint. And the first aim and objective is to understand different types of academic articles and their specific structural requirements, to master an early career researcher with academic writing styles and the use of reference management software. And the third thing is to identify reputable and indexed journals and to avoid the predatory publishing traps. The fourth aim and objective is to navigate an online editorial system, prepare a submission package, and respond to reviewer feedback, which is most important thing in publishing and manuscripts. And the fifth one is to establish a professional digital identity to track and metrics and maximize research impacts. The workshop will be 4 days and maybe extended to 5 days. The day one, we will talk about demystifying the landscape and crafting the manuscript. The first session will be presented by Dr. Alkhair Adam, and the session will be a foundation of academic publishing. And the second session will be conducted in the next day, because this first day will be the first session will be long, and the second day will be publisher journal selection and referencing. The third day will be submission and peer review and post publications, and the fourth day will be peer review and building your digital identity. Assessments: participants will complete practical exercises to demonstrate their skills in drafting a manuscript section, select a target journal, prepare a mock submission, and to respond to reviewers, and will be there by the end of this workshop will be a certificate from the CBD of the National University after completing and attending all sessions and completing all assessments. What are the expected outcomes by the end of the workshop? Participants will understand the full publication process from a manuscript till printing. Secondly, to identify appropriate journals and avoid predator publishers. The third expected outcome is to establish a professional academic profile across key platforms. And the fourth expected outcome will be to prepare a submission-ready manuscript with proper structure and formatting, and to use reference management tools effectively to automate a citation, and then lastly to apply strategies to increase research visibility and impact globally. Let me first of all thank all attendees, and my name is Awadallah Ali. I'm pharmacist and Deputy Academic Affair at National University, Director of the One Health Center. And let me also welcome Dr. Alkhair Adam, PhD in medicinal chemistry and drug designing. And also there's Professor Abdullah Osman, Professor of Microbiology and a researcher. And let me thank Dr. Muhammad Osman for designing this the poster and even the registration of the participants in this workshop. Let me first of all welcome Dr. Alkhair, and the floor is yours, Dr. Alkhair.
Hello. Thank you, Dr. Ali. Thank you very much for the nice presentation, and welcome all participants and attendees. My name is Alkhair Adam Khalil, as introduced me my colleague Dr. Ali. I'm originally a pharmacist, and I completed my PhD in drug discovery recently, and I'm the manager of the recently established Drug Discovery and Bioinformatics Unit within the One Research Center in the National University. And I also work as a lecturer of pharmaceutical chemistry in various schools of pharmacies here in Sudan. First of all, I would like to thank the participants for joining us today, and I hope they benefit from our organized sessions today and in the upcoming days. I hope my voice is clear for you. Is it clear?
Yes, it's clear.
Okay, thank you, Dr. Ali. Let me share my screen so I can start my session. Just a minute. Is it showing? Can you see my screen? Okay, thank you. So our first session is the foundations of academic publishing. I'm trying to guide you through the process of publication from the start till the end. But today we just will have an overview of the publications, academic publications, and the types of articles, and an overview of the ethical practices in publications. The objective of this session, we have 4 objectives. Number 1 is to understand the publication ecosystem, the modern ecosystem. And then we will differentiate the different types of articles. So you will be familiar with different types of publications. And then we will briefly discuss what is known as IMRAD structure. IMRAD stands for Introduction, Methodology, Results, and Discussion, the normal skeleton of research paper. And finally, we will discuss the ethical publishing practices. So, what is academic publication in the first place? Academic publication or academic publishing is a subfield of publishing which distributes academic research and scholarship. So this is a way as scientists communicate our knowledge. We want to collaborate together, and one researcher can take the steps of another researcher in order to advance the science. So through publication, we can collaborate and we can disseminate knowledge. And actually, publishing is the primary tool for scientific progress. And through the peer review process, we can validate our findings, our results, and produce quality science. Because when you do a study, this study before publication should be reviewed by one expert or two, or sometimes more than two experts. We call them reviewers, in order to validate the results and findings. And this publication or studies published in literature or in the databases are permanent record of human knowledge. So whenever you publish a study and it is indexed in the databases, it will remain permanently on those databases. And also one of the benefits of publishing is to bridge the gap between local research and global impact. Say, for example, we did a study here in Sudan, and the study is really good, and the outcomes are significant. We want the others in all around the world to know about this study and its outcomes. This cannot be achieved unless we publish the study. So this is why we do publication. Historically, in the early days, scientists before the 17th century, they deal with science with a great degree of secrecy. They normally don't disclose their methodology or their way of getting their data or any aspect of the result. But afterward, because of the development of science and the mentality of people dealing with science, that it is essential to share the knowledge in order to advance. So in 1665, in the 17th century, what we are seeing in the slide is a paper or a cover from the transaction or the philosophical transactions, which is one of the first journals that is dedicated for science. It was published by the Royal Society of Science in London, and it is considered one of the first journals to be dedicated to publish academic literature. In the early 1990s, about 30-something years ago, because of the advance in internet and communication, the publishers start to convert from the traditional printing of journals into the electronic formats or the digital format of journals. So this lead to rapid global dissemination of knowledge and advance in searchability, because any study published, it has its own DOI. DOI stands for Digital Object Identifier. Any study, it has its own unique DOI. So because of that, you can easily locate it online. In the modern era, nowadays, the ecosystem actually is controlled by a network of stakeholders and several institutions and publishers. They control and monitor the publishing practices. And this ecosystem actually composed of several parties. The first one is the author, you or us as the researchers. We are the creators of the knowledge or the studies. When you are trying to publish your study or your finding after you complete it and you prepare your manuscript, the first contact point is the editor of the journal. The editor is the gatekeeper that ensures the scientific quality, integrity, and relevance of the study. So what the person you are in continuous contact with actually the editor of the journal. The editor has the decision either to reject your study from the first review, which is known as desk rejection. It is not suitable for publication, or if it is suitable for publication, it can move it to the next stage. It will assign several reviewers, either 2, 3, or 4, sometimes more, but normally they are 2 reviewers or 3. Those reviewers are, as I said earlier, they are experts in their field, the field you are working with. So they will review your study, and then they can provide one of 4 options: either to accept the study or the manuscript in its current format, and this is actually a rare situation. And the second option is to reject it if it is not suitable. And in that case, you have to improve your manuscript and resubmit it again, either to the same journal or to a different journal. And the third decision is to accept with minor revision. And minor revision means there is some minor issues in your manuscript, like the organization of tables, some grammar mistakes, and these are minor issues. You correct them and then resubmit your corrected manuscript, and it will be accepted. And the fourth and the last option by the reviewer is to make a major revision. So they may ask you to do some experiments again, provide more data, to do some work. So it is a major revision, and you need to resubmit it again for another round of review. So this is how it works. And then finally, after all the criteria are satisfied, then the editor will look at the reviewer reports, and then the final decision actually is the editorial board of the journal or the editor-in-chief to finally accept the publication, and then it will be published in the website of the journal, also in the journal itself. And then the publisher actually sent a copy of your study to be indexed in the famous databases such as Scopus or Web of Science or PubMed or the known databases for literature. So this is how the system works. So you need to survive all these stages in order to publish your study. So why we do this? Why we publish? Actually, there are a lot of reasons, but mainly I will discuss 5 of them. The first one is the dissemination of knowledge. The second one is career development. The third reason is for networking and collaboration. And the fourth reason is the validation and finally funding. We will come across all these reasons one by one. For the first pillar, which is knowledge dissemination, publishing is the formal mechanism by which scientists communicate their findings to the world. We have already said that. So it transforms personal informations or observations into public facts. So any fact in the scientific community now we know about actually came from observations and from studies. So, for example, we know that the sun contains hydrogen. This is a fact, but this fact came from an observation done by someone, and it is published at some day in somewhere. So, because of that, this observation now is a fact. So, what the impact of this dissemination of knowledge? Without dissemination, even the most groundbreaking research remains invisible and unusable by other researchers. So it's a must to communicate your knowledge. The second pillar is the career advancement, and this applies specifically for those like myself, like Dr. Ali, and all our colleagues working in the academia, in the teaching in universities or in research institution. In order to advance in our career, we have to publish. And we have a famous expression, which is publish or perish. So if you want to continue in your position as a researcher or a university teacher and so on, you have to continuously do studies, do publication. And actually this put a lot of stress or a lot of pressure on the teaching staff. And actually, I think this is one of the reasons we may see some low quality or under quality publication because of this pressure to publish. But we need to do, actually, as I said, quality publication. So the publication is academic, is important for the academic promotions and actually for institutional ranking and prestige. Many ranking of universities actually take into account publication and the number of publication of the institution. So the ranking is affected extremely by the publication produced or the study or the science produced by that institution. All of us know about, for example, MIT in the US. MIT is one of the top institutions in the world because of the research and publication. It's the main reason, and the products or the services came from this, from their studies. And finally, for the recognition and subject matter, to be an expert in any field, you have to study hard and you have to give your contribution. This contribution is given in the form of publications. The third pillar is very important for us, actually, is the networking and collaboration. Publications serve as a calling card to potential collaborators worldwide. So, a researcher from Sudan can collaborate with a researcher from Japan, for example. And this collaboration may lead to a lot of benefits to both parties, either individually for the researchers themselves or to their immediate colleagues in their institution or to the country. So this collaboration actually happens when the researchers or the teachers or the academicians meet in conferences or when they publish together. This is a very important aspect of publication. So many international collaborations begin because a researcher in one country read a paper from another. The fourth pillar is validation and quality, because as I said, we need to make sure what we publish is actually a good science and it is actually true, and there is no flaws or mistakes in the methodology or the results or the outcomes of those publications. And this is achieved by the system of peer review. So here in this picture, you have the scientist who is trying to reach the end line. Here we can read paper accepted. So this is a challenge, and he need to survive all these people. They represent the viewers. Actually, it's just a joke, but they are not trying to kill him. But it is actually a very stressful stage of application is to deal with the reviewers and try to convince them that what you are producing is scientifically correct. So because of this review process, this provide an objective assessment of the methods, results, and conclusions, offering validation to the claims. The fifth and the last pillar is funding and grants. When you apply for a fund, for example, or a grant from different organizations like the WHO or the Wellcome Trust Fund or the NIH, one of the determinant factor for accepting your application to get the fund is your publication record. How many papers you have published, and what are the impact of these papers you have published, because they indicate if you are an expert in this field or not. So these are very important aspect of publication. Actually, a lot of projects worldwide, especially in our health sector, is funded by external funds from different organizations. So our role as researchers in our field or any field is to look for these opportunities and try to take advantage of these funds for our growth and prosperity. So these are the answers for the question why we do publication: for the dissemination of knowledge, for the career development, for the collaboration, for the funding and grants, and for the validation of our work. I want to move to the scientific toolkit. What are the types of papers or research articles that are normally found in academic literature? Here I have the main 4 or the main 5 types. There are a lot of them, but these are the most famous ones. We have the original research, which is actually the most famous one. You are doing a study, you have a knowledge gap in certain area, and you are trying to bridge this gap, or you are trying to discover new products, new drug, new technique, new technology. All of these are original research. So what you are producing is known as primary data. So these are primary data that when it produced, it can be used by others in order to advance the science. So these are original research or original studies. So you have a new finding. The second type of article is narrative reviews, and we'll discuss them in details in a moment. But here you don't produce any data, but you are trying to summarize the current state of knowledge in certain areas, and we have different types of reviews. And then we have the systematic reviews. Here you collect several studies and try to do an exhaustive literature synthesis depending on statistical analysis. And is actually one of the strongest type of studies you can do. Number 4, we have what is known as case reports, and this is mainly found in the medical field. I know that the audience of this workshop came from different backgrounds, but most of us are from the medical field, but also we have others joining us from engineering, from science, general science, from administrative science, and so on. In case reports, actually just report an outstanding or a rare case, medical case, and you just describe the observations on that case. And finally, we have what is known as letters, editorials. This came from experts or experienced researchers and professors, and actually most of them are done through invitation. So the journal invite a guest author from different institutions to give an opinion or to write an editorial on a specific issue of the journal. Or sometimes one expert person may write a letter for the editor in chief of certain journals to address certain advanced issue or certain current problem that to draw the attention of others to this problem. So we'll cover all this briefly. The original research article, actually known as the bread and butter of the academic publishing, is the most famous types of articles we encounter in literature. So as I said, we present the new primary data, and it strictly follows the MRAD format: introduction, methodology, result, and discussion. And it includes detailed methodology for replication. This is a very important aspect. And I realize that some of the studies, they don't report the methodology in details. And actually, it is not a good practice, because when you publish your study, anybody or any other scientist should have the ability to replicate your study. So you have to report even the minor details in your methodology. So the goal is to fill the specific gap in scientific knowledge through empirical study. Then we have the narrative and many reviews. The narrative reviews a broad overview of a topic. For example, if I want to make a review on, for example, breast cancer, for example. So I will try to collect studies in certain period of time, for example, the last five years, and try to summarize what currently we know about breast cancer. This is a narrative review. So expert authors provide a synthesis of existing literature without a strict protocol. Here, the publication actually is highly flexible. There is no strict template like the MRAD you have to follow. So the narrative reviews are highly flexible. And then we have mini reviews, which is a review, but it is shorter, focused on a niche topic or very recent development. And this is usually invited by the journals. So if a journal, for example, has a topic on green energy, for example, they invite one of the experts in the field to write a mini review about the status of green energy nowadays. Then we have the systematic reviews and meta-analysis. And as I said, it is a pinnacle of evidence-based practice. It's a very strong type of studies when they are done correctly. And actually, it is at the top of the scientific evidence pyramid. So when it is done correctly, the outcomes of this study are highly confident. For example, when an organization reports, for example, the prevalence of malaria in the last year is something, or the number of cases of malaria in different parts of the world actually came from meta-analysis of many studies. So it is high synthesis following strict protocol known as the PRISMA. And we do the meta-analysis which is statistical pooling of data from multiple studies. The clinical or the case report is a clinical insights, detailed report of the symptoms, signs, diagnosis, and treatment of an individual patient. So you are reporting one individual patient, maybe a unique or a rare disease or unexpected association between his condition and another factor, or you are reporting an observed side effects for the first time, it has not been observed before, or a rare presentation of some rare disease. The structure of this article follows a normal format, actually abstract, then introduction, then you describe the case, discuss it, and finally the conclusion. And the editorials and letters to editors. The editorial is an expert commentary on a specific issue or paper published in the same issue, usually by invite, as I said. And the letters are critique or support from recently published article. It is short, direct, and evidence, but sometimes it may be just one page, the letter, and the editorial as well, maybe 1 to 2 pages. So it's very short publication. But as I said, this is actually done by experts in the field. If we compare all these main types of studies, you can see that in reviews, we don't produce any primary data. We just deal with secondary data. And in original research and case report or case studies, we are actually producing new data. And this is a typical range of the words count in publication. For the original research, normally the journal may limit you into certain number of words in your total manuscript. And to know this information, actually, you need to log in into you need to open the website of that journals and look at a title which is normally called Guide to Authors. So they provide a guide for the authors. And this guide actually is a very long document, detail each and every aspect of the manuscript, the titles, the number of words in the abstract, and so on. So normally for the original research, it may be anywhere between 3,000 and 5,000 words. For the reviews, it's more flexible because the reviews, you're actually collecting a lot of studies, a lot of data. And for the case report, it is about 1,000 to 2,000 words. The structure for the original research is strictly the IMRAD, Introduction, Methodology, Result, and Discussion. For the systematic review, we have the PRISMA, stand for Preferred Reporting Items for Systematic Review and Meta-Analysis. This is a guide for anyone who wants to do a systematic review. It is a 27-item checklist and flow diagram designed to improve the transparency, completeness, and reporting quality of systematic review. And before even you conduct the systematic review, you have to register your protocol. There are some websites you have to go through them and register your study before even collecting the data. And after you finish, and when you are writing your manuscript, you indicate that in your manuscript that I have registered the protocol in the XWeb website, and is a number of the ID number of the protocol. The narrative review normally follows thematic structure, so it is up to the author to design the manuscript. Okay, so which article should you write as a beginner or as an early career researcher? If you are actively producing new data, you are working on primary data, you have to write original research. But if you are yet to start in real laboratory-based study or field-based studies, you can train yourself by writing review articles. When you are writing review articles, actually, you expose yourself to a vast amount of information. You collect a lot of data, and actually you train yourself on the academic writing. To write an article correctly, you have to read so many articles to understand or to follow the, the flow of information within the article, how the authors present their studies, how they describe the conditions, how they design the figures. So review articles actually is a good starting point for you in academic writing and publication. And actually, when you submit them, they go faster compared to the original research, because actually you are just discussing already published data. So, for example, if you are a physician and you are following, for example, a new surgical technique for a patient with a rare heart condition, this is a good opportunity to do a case report study. You can write it and submit it to a specialized journal, and it will be published. And for example, if you are a laboratory, a medical laboratory specialist, and you analyze a lot of samples, you can write, for example, a study on the prevalence of certain disease like malaria in a local community. This is an original research. Scenario C, if you are combining statistical results from several trials on certain drugs or certain compounds like vitamin C, you can do a meta-analysis on these 12 studies. Actually, 12 is a minimum number or the gold standard to do a meta-analysis. And if you have more, you can do a better meta-analysis based on the number of studies and the quality of these studies. So anybody can do it. And by the way, I know that we have a lot of undergrad students among us today. And in this workshop, I want to emphasize that to publish, you don't need to graduate or you don't need to have a higher degree. You can publish even if you are in the high school. Journals don't care about your current job. Just what you are producing is science, so anybody can publish. So don't wait until graduation and then think about, I want to publish. You can publish right now. So this is a very important aspect of undergrad, to know the skills of writing, academic writing, and publishing. Even your graduation project can be published if it is suitable for publication. So try as hard as possible to start your publication practice as early as possible. In addition to the main types of articles, we have other types of articles also can be published, like brief reports or short communications. These are concise papers, very short, designed for the rapid dissemination of significant, early or self-contained original research findings. For example, if you are doing a project and the project has not ended yet and the study is not finished yet, but you produce a lot of very important results or very interesting results, you can publish these even before the study ended. This is known as short communications. The second type of article is the methodology articles. These are papers for just new methods. For example, if you discover or if you design a new methods for testing glucose in human blood, you can just publish this method. Or if you if you are an engineer, for example, and you have discovered or developed a new method of building different skeletons of building. I'm not an engineer, but I think the idea is clear. So these are methodology articles, paper focused entirely on introducing, explaining, and validating a novel or significantly improved experimental, computational, or clinical methods. And also we have what is known as dataset articles. Dataset articles, they are just dataset publications that thoroughly describe a valuable peer-reviewed dataset and its generation process to make it discoverable and reusable without drawing scientific conclusions. And for example, in my field in drug discovery, if I work a new series of compounds, 50, 60 compounds, I can just share my findings into some repositories. I can place my library for anyone to use this library for his research. These are dataset articles, and actually there are certain journals that are focused or specialized on this type of articles. They accept any new datasets that are peer-reviewed. And then we have also specialized academic archives, different varieties. For example, protocols and pre-registration. Earlier when I discussed meta-analysis studies, I said that you have to register your protocol before the study begins. So this is some sort of publication. For example, the study protocols detail experimental design, sample sizes, and plant analysis before data collection. It prevents the PE hacking. In statistical analysis, actually some bad practices is to try to get a significant statistical result. This is known as p-hacking, by manipulating the data. So if you pre-registered your protocol, you cannot do that because you are strictly describing what you are going to do. So you can no longer prevent. So you can no longer adjust the data to make it significant. This is the importance of study protocol registration. And also we have registered reports. This some found in some cases a two-stage review process. In the first stage, you provide your methodology or protocols and so on, and the journal accept or the peer review the methodology and the protocol, and then provide conditional acceptance that when your methodology is rigor, they will guarantee publication of your article afterwards. So a two-stage peer review process. Acceptance is granted based on the methodology rigor, guaranteeing publication regardless of whether results are positive or negative. For the scientists who work, for example, in the computational and software and tools, we have the digital infrastructure. For example, if you design or if you invent new software to do a certain task or new algorithms or even plugins, you can publish your finding. So it introduces novel open source software
So I think Dr. Khair lost connection. Just 3 minutes to be reconnected. Please also go through I sent a Google form in the chat. This is for registration. Please write your name in English, first name. Please go through it in the chat.
Zero finding or negative finding is very important aspect. And
Dr. Khair,
yes, Dr. Ali.
sorry, I think you lost the connection. And
Sorry.
yeah, and also the screen is not shared.
Sorry.
Please fill the form. Write your name in the form. I send a Google form. Please go through it. I will resend again. Yes. Please fill the form for the attendance today.
Please, Dr. Ali, at which stage I lost connection because I don't know. I was talking the whole time.
Sorry. Can you share screen?
At which slide?
No. I think this one. Yeah. Specialized academic article type.
This one?
No. Yeah.
This one? Protocol
Yes.
and pre-registration? Okay,
Yes.
sorry. Okay. I'll try to start from here. This is one of the specialized articles, the study protocols, which is registered in certain websites, like for clinical trials, for meta-analysis studies. In these type of studies, you have to register your study even before you start. The protocol should be acknowledged and should be available. And once you publish your study, you should strictly adhere to what you have written before. No data manipulation, no alteration in the protocol. You have to follow the steps for your articles to be accepted. And also we have the register reports, which is a two-stage peer review process. Acceptance by the journal is guaranteed based on the methodology rigor, guaranteeing publication regardless of whether results are positive or negative. And also for the scientists who work in the digital infrastructure, for example, if you invented a new software or a new algorithm, you can write an article describing the development of this software, its capability, and how it works. So this focuses on architecture, system requirements, and performance benchmarks. Also, we have the database articles, which provides major updates to public databases. A database, for example, like the PubChem database, for us as a researcher in the medicinal chemistry, we know the PubChem. It's a database for all the chemicals known to human. So when you invent a similar database, for example, or you have designed a new website for such database, you can write an article explaining the data curation methods, the query interfaces, and the specific gaps filled in existing repositories. And we have very interesting type of articles, which is known as null or negative findings. This is a very important part in science, to know the negative results. Negative result is not always bad. Actually, sometimes it's required to know the negative results. Say, for example, I'm working on development of a drug for the treatment of certain viral infection. I did the experiments, I did the in vitro testing, the in vivo testing, and the compound failed. So I should report this because someone may try the same compound after me. So if I told him that this compound is not working, he will not use the resources and the time I might need it for such failed experiments. So this is known as a file drawer problem. Many of us, when we do experiment and it fails, we just throw the paper into the drawer and forget about it. This is not good, actually. And also, we have the conferences and events. If you attend a conference and you are participating in the conference with a paper, during the conference there is known as what is known as the book of abstract. This book of abstract is not a publication, but after the conference, the papers that had been presented in the conference will be published in what is known as conference proceedings. This conference proceedings is considered as some sort of publication. Of course, depends on the conference itself and how reputable it is. And then also we have the meeting reports, high-level summaries of key themes, presentations, and future research directions discussed in symposia or workshops like the workshop we are doing right now. If it is a scientific workshop, we can publish the outcomes of this workshop. So this specialized type of publications, and even after publication, we have some update post-publication. Sometimes there are some errors that may be discovered after the article has been published. So journals normally can do correction. They can ask the authors to correct the mistake. But the original publication is already there. So they update the previous publication by a correction publication. It is a formal correction for publisher or author errors discovered post-publication. And sometimes some researchers or some scholars, they may conduct or they may commit some research misconduct. They may publish false data, manipulated data, flaws in their methodology, or any problem. And after the journal has discovered this, or somebody who read the articles may report to the journal that this articles contains 1, 2, 3, 4 problems, the journals may issue a retraction. Your article will be withdrawn from the database. So because of that, so this is known as retractions. And actually, nowadays we have a website called Retraction Watch, who regularly report such retractions. And some retractions actually came from highly experienced or highly famous authors. Some of them even are Nobel Prize holders. So this retraction may happen even years after publication. So we should have living documents to ensure the scientific records remain self-correcting and historically accurate. So this is how the publication works, and these are the types of publications. Before I start the next topic, I would like to open the floor for questions and for discussion. Back to you, Dr. Ali. Hello. Is there any question or any opinion or any discussion so far?
Hello, Dr. Alkhair. Hello, everybody.
Yes, yes, Dr. Ahmed.
We are really delighted to have you here with Dr. Awadallah and Professor Abdullah Uthman. It's really useful to have such a workshop for us at early academics or graduates, or even for a first year or second year, such as bachelor students. So we are really thanking you for initiation and this workshop. There is a question in the comments. I just need to read out. Someone is asking the meta-analysis or systemic reviews are our papers should be original papers. I think he means to do a meta-analysis or systemic review. All the articles or all the previous projects has to be an original, or it can be previous meta-analysis as well.
Okay, thank you for the question, Dr. Mohammed. When you do a meta-analysis, you are producing new data, or you are discussing existing data. You are discussing an existing data. So the original papers you are collecting should contain data, new data. So you cannot, for example, do a meta-analysis on a meta-analysis. I'm not sure what you are doing, but if you want, you can collect the original studies in each of the meta-analysis and try to do your independent meta-analysis from several studies. You cannot do meta-analysis on review articles, because review articles, they don't contain new data. It's already just narrative reviews. There is no data. So I think the paper should be an original research. At least you need between 12 to 17 studies to start your meta-analysis.
Yes, Dr. Khair. Hello?
Yes, Dr. Ali.
Yes,
I hear
thank you.
you.
Thank you very much. Yeah, I think Dr. Sanaba, our brother from Senegal,
No, from
you're from Gambia. Sorry, Sanaba. You're welcome. I can add that not necessarily for a systemic review or meta-analysis. They included a study in them, as Dr. Khair said, are usually primarily original research articles, because they provide the data or the raw data and even the outcomes needed for analysis. But however, review articles and even guidelines and even editorials and even the conference paper can be useful during the background reading stage to understand the topic, and also to identify the key studies, and also to define the question of the research. For the meta-analysis specifically, only studies with sufficient original quantitative data are typically included in the final statistical analysis of the meta-analysis. I hope you get my point and answers the question.
Yeah, thank you.
Thank you very much, Dr. Ali.
You're welcome. You're welcome, Sanawa.
Okay, any other question? So if there's no question, we can continue to the second topic, we have today, which is there is a question here. For publishing a paper, should I be a participant of an institute? No, you don't need to be a participant or an employer for what I understand from you to be an employer of or an employee of a certain institute. You can write your affiliation. For example, if you graduated from the National University, you can just write I'm affiliated with the National University. So it's not it is not a must to be working in certain institute. There's a question from Samira. Okay. I hope I answered your question.
Yes.
Okay, can we proceed or there is another question? You can raise your hand or even you can unmute yourself so you can speak. Can you give us some example for some of Sudanese study, qualitative, have been funded and some of the results? Thanks. For the qualitative studies, there are a lot of studies that has been funded. Even myself, my PhD study was funded by other organizations. I got a grant from the Wellcome Trust, and also I got a scholarship for my small PhD study. So you can get funded, but it depends on the quality of your proposal when you submitting your funding proposal, and if whether your study is worth funding. So grantmanship or the writing of proposal for grants actually is a skills you need. It is a skill you need to learn, and there are a lot of online courses or workshops for to teach you how to write a proposal for a grant. I remember when we were in the first year in the PhD, they organized a workshop for us in that session, the grantmanship. Is from Muhammad Osman Ibrahim. I hope I answer your question. Okay, so let's move on. Dr. Ali will guide you through the art of academic writing, but here I'm just giving you an overview of the writing of the manuscript. And the word manuscript is the paper before it's being accepted. After acceptance, we call it an article or a paper. But for that, when it is just a draft, when you are writing your paper, we call it a manuscript. So this manuscript follow a certain structure. For the original research articles, as I said, it follows the Emirate backbone, which is the introduction, method, result, and discussion. In the introduction, in all these sections, we answer certain questions. In the introduction, we answer why this study is important and why we are doing it in the introduction. In the method, you are describing how you did it. In the result, you describe what you are getting, the result you are getting. And in the discussion, you answer, so what? What is the importance of your outcomes or your findings? So for the introduction, this part of the manuscript, it should be short. It should not be very long. For example, several pages, ideally 1 to 2 pages maximum. And it should contain several paragraphs, at least 3 or 4 of them, describing the background of the problem. And you can have a brief literature review, not a comprehensive literature review. You just describe what we know about this problem. For example, if you are writing a manuscript for tuberculosis, for example, you just describe what we know currently about tuberculosis. And then the most important aspect of the introduction is to discuss the gap, what we do not know about this problem. And here you are proposing your intervention. I will bridge this gap by doing so and so. So at the end of this introduction, you should clearly specify your aim and objectives. And don't mix writing of manuscript for publication and writing of introduction in thesis or dissertation. They are completely different. In thesis and dissertation, we write a chapter of introduction and literature review. It may be a very long chapter. You cover a lot of publications, a lot of papers, a lot of research articles. But here, we just focus on these 4 points: the background, the current knowledge, the current gap, and how you planning to bridge this gap, and finally, the objective or the aim of the study in one single paragraph, the objective, not as a bullet paragraph, for example, A, B, and C. No, just as a continuous sentence describing the objective. So make your objective clear. By the end of the introduction, the reader should know exactly why your study is necessary. Okay, so this is the introduction. Okay, the second part is the methodology. And here, actually, there is a common mistake. As I said earlier, you don't report every and single step. So your study should be replicable, and anybody should replicate it. This is the recipe or the exact method for doing your study. So you should emphasize the study design and population sampling and data collection, the type of statistical analysis you have done, and also the ethical consideration. If you are doing experiments on animals or in human, for example, you have to strictly adhere to the recommendation or the guidelines from the IRB, the Institution Review Board of your institution or your country. The results section, here you describe the facts without interpretation. So you just bring your tables, your figures, and report your findings. For example, the p-value, the confidence interval. Address all objectives from the introduction. If in the introduction you aim to study, for example, TB, and you are collecting data from patients through any instrument you selected, you have to put all this data in the results. So do not discuss or explain finding here, just state what the data is showing. And finally, we have the discussion. This is the critical part of your study or of your manuscript, the discussion section. And actually, many of us commit a common mistake in the discussion is to reiterate the results. Discussion is not about restating. Come again, please. Is there a question? Okay, so don't reiterate the results here. You have to summarize your primary findings. You say that this result or the result confirms, for example, 1, 2, 3, 4, and the findings of this study is highly correlated with X, Y, and Z, and so on. So you summarize your primary finding, compare with existing literature, which is very important. So you have to cite the result or the findings you are comparing to in this part. And you can also explain unexpected results. For example, if you're expecting to get a positive result and you get a negative result, you have to discuss it, why you are getting a negative result. And then a very important part of the discussion is to state the strengths and limitations. Every study has limitations. So you have to genuinely and honestly discuss the limitation of your study. For example, if you are studying certain organism, for example, malaria, and you did your study on the chloroquine-resistant strains, but you haven't done it on the chloroquine example, chloroquine sensitive strains. You have to try both strains, the chloroquine sensitive and the chloroquine resistant, to see the difference. So this is one of the limitations, for example. And then you finalize your discussion by the conclusion and implications of your finding. So in the discussion conclusion, you answer the reader's question: why should I care about this result for my practice or research? So this is the critical part of your manuscript, and you convince reviewers to accept your manuscript depending on what you are discussing in this section. Okay, so the discussion should not be shallow. It should be critical and explain the finding clearly and discuss the strengths and limitation of your study. So this scheme, which is IMRAD, the Introduction, Methodology, Research, and Discussion, has some certain variations depending on the type of study. The original research, as I said, the original research article, they are strictly IMRAD structure. You have to follow this structure. But for the review article and other types of specialized article, you don't have to follow this exact structure. For example, in the review article, you have a thematic structure, you have an abstract, introduction. The thematic sections, you can divide it however you want, and then you write your conclusion. And also in conclusion, you can write what is known as future perspectives. In the case report, you follow a narrative structure, you write an abstract, we'll discuss abstract shortly, then the introduction, the case history, and the discussion of this case report. Okay, the abstract, actually it is the first part of your manuscript, but it is written the last one. You write your abstract after you finalize your manuscript, and it is the most critical part of your manuscript. You have to write it in an organized way and in a concise and a clear way. So it is a front door of your research. As I said in the beginning of my presentation, when you contact the editor and submit your manuscript, the very thing he reads is your abstract, and then he reads the conclusion. Normally, Dr. Ali actually is an editor of several journals. He can point out this point. So the first impression of your manuscript is your abstract. So an abstract is a concise, standalone summary of your entire research project. It serves as the primary filter through which readers decide to engage with your work. When you are, for example, if you are a student and you are working on a certain project and you are looking for some studies, the first thing you read is the abstract, and then you decide this paper is suitable for my project or not. The abstract also is important for discoverability because it is always indexed in the databases. Either it is open source or, it is open access or closed access. You will definitely find the abstract. So to discover your study, your research, and for others to cite your study, you should write your abstract correctly and in the correct format. The second thing is brevity. You need to limit your abstract to anywhere between 150 and 300 words. Actually, journals may have specific limits for the abstract. So before you write the abstract, you have to go to the website of the journals and look for their condition for the abstract. Is it 250? Normally, it is between 200 and 250 words normally. And the third aspect is independence. So it must be intelligible without the main text. So when I read the abstract, I should get a full grasp of what you have done. Okay, so from the draft to the discovery, as I said, number one, you have to write it last. The last thing you write in your manuscript should be the abstract. and then map out the IMRAT sections. When you are writing the abstract, you are discussing or you are reporting the problem, for example, and a very brief statement of the current knowledge about the problem, and then you discuss your methodology, and then you discuss your main findings or results, and finally you conclude your abstract. And you should distill it, so you remove any jargons or jargon or the technical terms used for specific field of study. So anybody who read your abstract should understand it without going through the need to interpret certain terminologies. And finally, you do a final polish to check against general word limits and word count, as I said. So this is an abstract checklist. What's the do and what are the don't? In the do's, use present tense for facts arguments. For example, if you are describing the study design, you use the present tense. You say, this study, for example, this study is using the X study design to so and so. So it is a present tense. And for the result, you use the past tense for specifying the study. For example, the study found that the rate or the prevalence rate of tuberculosis or diabetes among Sudanese people was so and so, okay? And then to define all unusual abbreviations, some abbreviations that are unusual or unknown for most of the people who are outside the field, you should define these abbreviations. And finally, follow the genus word count strictly. The don't in the abstract, you never cite a reference in the abstract. There is no citation. And it should be text-based, so no tables or figures. Although you can do what is known as graphic abstract after the main abstract, you can do a graph or a graphical abstract to describe your study. And also there is no speculation. You have to stay within your data you produce, no other data from literature or from your analysis. No jargon, as I said, keep it accessible to non-experts. We have also a very important strategy in running your manuscript. It should be search. I forgot the term actually. Anyhow, it should be optimized to be discoverable online. When you publish your study, when it is accepted for publication, it should be discoverable. The discovery of your publication help you in getting citations, for example, for others to cite your work. And when somebody is looking for a topic related to your study should be at the top of the search result. Okay, so this came from two parts of your manuscript. Number one, from the title of your manuscript, and number two, from the metadata and the keywords. For the title, it's a very important part of your study or your manuscript. Try to maximize, try to have a strategic title construction to maximize search engine visibility, craft concise, clearly descriptive titles that front load most critical keywords. Okay, and then we have the keyword itself. After abstract, you write a title, keywords. You put about 5 to 7 keywords related to your study. These keywords should include terms not already in the title, okay, to increase visibility, and use field-specific standard nomenclature, and to balance broad versus niche keywords. So these keywords need to be selected carefully in order to increase the visibility of your manuscript. And for the early career or for the authors who just started writing manuscript, actually, there are a lot of challenges, even for experienced authors, you have to overcome and you have to think about it. Number one is what's known as a writer block. When you start writing, you are getting confused, actually. What should I start first? Should I start with introduction, or should I start with the results or the methodology? What should I start first? Is the hardest part usually. Personally, I prefer to start with writing the methodology because I already did the study and I know what I did, so I start with this. And then you come to the hurdle of journal selection. What journal should I submit my study to? During this workshop in the coming days, we will guide you through how to select the suitable journal for your manuscript. And the third challenge is the time management. Most of us, or all of us, are working on other tasks or duties. Me, myself, I'm working as a university staff, so I have a lot of academic duties. So I have to manage my time in order to sit down and write the manuscript. Writing manuscript actually can take very long time, weeks for sometimes, or months, to write a proper manuscript. So you have to have a good time management. And the fourth challenge is the fear of rejection. Whenever you submit a manuscript to a journal, expect rejection. And rejection is not actually a bad thing if you think about it. Sometimes rejection may improve your manuscript, because when you resubmit it again, you are trying to figure out what's wrong with my manuscript, so you can increase quality of your manuscript after rejection. So think about it as a positive thing, not a negative thing. And all of us actually get rejected many times from journals, and every time we resubmit it, the manuscript get improved, and finally it get published. So if you insist, your manuscript definitely it will get published at some point. So don't worry about rejection. So a solution for practical productivity, as I said, start to write the methods first, because it is the easiest part to write. And from there, you can build the momentum, so you can write the other section. For the journal, nowadays you can use what is known as journal finders in the main publishers like Elsevier or Wiley. They have specific tools in their websites. You upload your abstract and your keywords, and then it will suggest suitable journals for you. So then you can select the best option for you. And for the reframing for rejection, as I said, treat it as free peer review, because when you submit your manuscript and it gets reviewed by a reviewer, the reviewer will give you invaluable suggestions and comments that increase the quality of your manuscript. One of the ethics of academic writing is to avoid plagiarism as you can. It is not. It is a non-negotiable condition. You have to cite anything that is not yours, even if you cite yourself. What I mean by cite yourself, if you are citing a study, you did it yourself. You have to write it in a certain way, and you have to cite yourself properly. So plagiarism is actually a crime. Also, we have the part of authorship and conflict of interest. What is meant by authorship? Normally, when you write a manuscript, normally we are several authors, not a single author. At least maybe two authors. The first author and the corresponding author. The corresponding author is the one who is in direct contact with the editor or the journal. We call it the corresponding author. And normally, if you are a student, it should be your supervisor. He is a corresponding author. So every name added to the author list should contribute significantly to the production of the manuscript. So you don't put your friend, for example, as a gift to be an author for such a manuscript. And at the end of the manuscript, normally the journals ask you to define or to state the role of each author listed in the author list, on the author list. So you mention, for example, if the first author is Alkhair Adam, you say that Alkhair Adam conducted the study or conducted the experiment, described or write the methodology, collected the data, wrote the original draft. So you have to state what each of the authors did in the manuscript. This is at the very end of the manuscript normally. And then you have to state any conflict of interest. For example, if you are doing a study for a certain company, for example, a waste company or a company that deal with human waste and so on, and you want to measure the impact or the ecological or the environmental impact of that company on the environment, and you work for the same company, this is a conflict of interest because you are reporting your own company. So you have to state that in the manuscript that I work on that company and I did this study. These are just an example. And if there is no any conflict of interest, also you have to state that the author declares, the authors, not one author, all the authors declare that there is no any conflict of interest. Dr. Ali also will guide you through the ethical use of AI research, but here what I recommend is just to use it scientifically and should not use it to produce data or results. You can use it for grammar checking, for improving the readability of your statements, and so on. But never use AI to generate new data, especially the LLM, the large language model like Gemini or ChatGPT. These are models just for language. And I will conclude by this quote from Sir Mark Walport. He was the chief scientific advisor in the government of the United Kingdom. He said that science is not finished until it is communicated. So we have to communicate our science through publication. And I have 5 take-home messages. Number 1, publishing is your career and advances science, both of them. And then choose the right article type of your data depending on your study. So you have to know which type of article I should write. Number 3, master the Emirate logic. And number 4, productivity is a habit, not a talent. So you have to train yourself to be productive and manage your time. And lastly, maintain absolute ethical integrity. So this is my presentation. I thank you for your listening, and I'm ready to hear any question or any discussion. Okay, the slides will be shared. Lina Muhammad, the slides will be shared in the WhatsApp group. Thank you.
Hello, Dr. Alkhair. Hello again.
Yes,
A
Dr.
common
Muhammad. Go ahead.
question I've always been asked through my community. It's about the funding for publishing. So many articles require a decent amount of money to publish, especially the open access. So, is there any ways so someone can grant a funding or partial funding from the same papers or the same journals to overcome the high amounts of payments that can be required? So, do you have any hints or any specific steps to override this?
Okay. Thank you, Muhammad, for this question. Actually, it is a very important thing we are going to discuss during this workshop. We want our audience and all Sudanese researchers to know that actually, because we are part of the third income countries or third and developed countries, you don't need to pay what is known as APC, which is a article processing charge. For
Yes.
open access publication, there is a scheme, for example, from different publishers like Science for Life that offer 100% discount on the APC. So once you are a Sudanese, you don't need to pay. So this is a good news. So if you are looking for funding, try to use a fund for another aspect of your research, but you don't need to worry about the open access publication. We can take advantage of that.
Yes.
Thank
you. Yeah. Thank you very much, Dr. Alkhair, for this nice presentation. And thank you, Muhammad, for asking these questions. Let me add that many journals, as you said, Dr. Alkhair, charge article process. Many journals charge article processing charge. The Sudanese researcher, as you said, they can still publish through waivers. Many publishers they provide a full fee waiver for researchers from Sudan and other low-income countries, like public journals, Frontiers, BMC. Also, as you said, Research for Life can provide the access to journals and sometimes support the researcher from Sudan and other developing countries through partnership and even through publishing initiatives. The most important thing that as Sudanese we can benefit from it, also the collaboration with international researchers. While the collaboration with international researchers, for example, like researchers from funded institutions, they can help the ABC coverage. Also, they can help in technical support and manuscript editing, and most important thing, they can cover the ABC. The most important thing, we can seek for collaboration. Sudanese researchers or other researchers from developing countries can request an ABC waiver before submission. This is the most important thing. Before submission, you have to request an ABC waiver from the journal where you want to submit your article or manuscript. Even you can mention in the cover letter the financial hardship, and also you can target the appropriate journals to the study scope, and they have ABC waiver. Thank you very much.
Thank you, Dr. Ali, for the information. And may I add that even some journals, when you are submitting, and even if you didn't request waiver of your ABC, and the system detects that you are from Sudan, it automatically will select you for waiver of 100% because of your this sometimes happens. So for that reason, we want our colleagues, our young colleagues, to avoid the predatory journals that promise you to publish your work for a reduced fee, like for $10 or $20. Actually, you don't need to pay anything to publish your work in highly reputable, highly impact factor journals.
Thank you, Dr. Alkhair and Dr. Ali, for such insights. It's been a really great information to have.
If there is any question, I have some. Okay.
Yeah, in the chat box, I think.
I'm not seeing it actually.
Is Rahaf or something? Yes. No. Halima. Hello. Thank you
Halima.
for this great session. How can I value my research? Is it worthy for publishment or not from the beginning? Is the case study of any values for publishment right now?
Will you ask this, Dr. Ali, or should I answer her?
Sorry?
Should I answer it, or you will answer her?
No problem. You can go and then I will.
Okay. If you are starting recently in the field of writing manuscript and publication, try to have a senior or someone who already went through these processes. He will guide you. Normally, your professor or your supervisor. He will give you the necessary information to proceed in this area. And you can also take the opinion of someone who is an expert in the field of study you are doing the manuscript on it. Definitely, he will help you.
Yes. Also, let me add something, Dr. Alkhair. To evaluate whether your research is worthy for publication, I think from the beginning, I can ask, or we can ask ourselves few questions, like does the study address a real or important problem nowadays or not? This is the most important thing I have to ask before I conduct any research. Is the study address an important problem nowadays or not? Also, the second thing I can ask before to start the study, is there any knowledge gap in the literature in the study or not? And also, I think that if I conduct the study, can I provide some new data or even new population or new perspective to the literature or not? This question I can ask before I conduct any study. So by the end of answering these questions, I can evaluate whether my research is worthy for publication or not.
Thank you, Dr. Ali. Okay, I have some reminders for the audience. Okay,